Well, thank you, Lynn. And thank you to Jewel and the Canadian Society for Physician Leaders for the opportunity to participate in this afternoon's award ceremony on behalf of the CMA. The CMA's mission is to help physicians take care of patients. That means we're always looking for opportunities for physicians to engage on issues that matter to us and the people we serve, opportunities that resonate across our country. Each year, this conference provides us with an opportunity to pause and think about physicians' unique role in our healthcare system in a world that is constantly changing. We can all recognize that keeping up with the rate of change in medicine is no mean feat. Many of us are practicing in a world that's vastly different from that when we graduated from medical school. Increasing demand threatens to swamp our system, and financial pressures from governments are at an all-time high. As physicians, we're constantly looking for ways of doing things better and differently, ways that focus upon our patients, ways that focus upon health as well as disease. We think about how we can best apply our skills to effect change in and out of our practices. Innovation and innovative thinking is really the backbone of our work. Through events such as these over the last 2 days and at this conference, we can come together to develop the skills and the great ideas that drive healthcare changes and will have a real impact on our patients and the system. Our panel just now, although in jest in large part, brought out some truths in this. To me, being a patient, a patient as well, being a physician and being a leader go hand in hand. When and where the need is greatest, we step up and find the solutions we need to make real change happen within our healthcare system. If I could have the slides, please. Thank you. You will be aware that the Canadian healthcare system compares dismally in comparison to 10 other similar OECD countries' systems. And yet, we spend in the mid-range to support it. Our record on Indigenous health is dramatically worse, notwithstanding their well-known resilience. And this has nothing to do with how hard physicians work. We work hard, as do our nurses right beside us. So why is this? There are a number of reasons. The land of 100,000 healthcare silos, the fracturing of our system, the low number of physicians compared internationally, the lack of supported generalism within our system. And in the midst of this, we have drifted away from our social contract with society. Doctors and planners have not been sitting around. Healthcare policy over the last 5 decades has seen a number of erudite reports from experienced and thoughtful people and commissions. But not too many of these reports' recommendations have been enacted. But as Dr. Mamta Gautam reminded us this morning in her excellent seminar, being right is not enough. So let me test with you an alternate approach to healthcare improvement. Rather than producing more reports, providing the answers as we see them, and asking other people to join our vision, perhaps we could take a different approach. Our low international ranking reflects system problems, and to address this, we need all the system players to work together. The panel came to that in some respect. So we must engage broadly. And again, we were reminded earlier today that relationships are as fundamental in constructive healthcare policies as they are in reliable medical practice. We must invite and engage a roundtable discussion of all the healthcare pentagram partners: governments, the medical and nursing professions, the public, universities, and healthcare managers. Can you imagine putting all these people in a room, not to produce more reports, but to break down siloed thinking and share a healthcare vision together to support and connect our fractured healthcare system? Some places have done this, started to do this. Nowhere, to my knowledge, has this been done on a national basis. We can agree first upon a healthcare vision, contribute to that vision with an appreciative inquiry approach, offering what each of us can bring to the table, not what others should do. And we can devolve more detailed tables along the same template. This is a different process, perhaps not an easy one for physicians who spend our lives thinking through medical solutions. It has a long-term horizon, but let's contrast this with our current approach, which has taken the last 50 years and got us to where we are now. This is an approach that has a better chance of digging Canada out of the hole we find ourselves. Chris just now suggested we need a messianic political leader, a hierarchical approach. I would suggest to you we need agreement to work together. Perhaps you believe in restoring the social accountability I spoke of earlier. Perhaps you have reservations. In either event, I'd be delighted to hear your guidance and learn how to assist your leadership. For you are truly the future of healthcare. Let me say it again, ladies and gentlemen. You are the current and future of healthcare in Canada. You will be making these decisions and following these actions. Are we up for a different challenge? Now, let us honor the stellar accomplishments of our colleagues, the CCPE candidates. Thank you.